Most expectant families anticipate their baby will arrive close to their due date, but you met your baby, or babies, earlier than expected. Just how old is your baby? This seems like a silly question, but it's not. Though the full-term baby has 40 weeks to get ready to enter the outer world, your baby came early. Her due date, rather than her birth date, is the best indicator of what to expect. This baby, born 4 weeks early, will still behave like a newborn 1 week after her due date. She may sleep up to 20 hours a day and need to be awakened to feed every 3 hours. Because her mouth and face muscles are still developing, she may not be able to fully breastfeed yet. You may need a lactation consultant to help you plan to pump your breasts and to give your baby your milk, with a special bottle, cup, or syringe. Hand expressing, along with pumping your milk, will significantly increase your milk supply. Because early babies are easily overstimulated, most are not ready to play with their loved ones until they about reach their due date. For now, your baby enjoys a quiet snuggle or an occasional face-to-face moment with you. Now is the time to learn your baby's body language. It will help you provide the sensitive care and attention that baby needs to catch up on time she missed in the womb. You may initially be puzzled by your baby's behavior. Is my baby waking up to eat, or is she trying to get back to sleep? Why does my baby sleep so much? And why won't she look at my face? The confusion you feel is because your early baby is still developing clear sleep-wake cycles, which we refer to as newborn zones. Full-term babies have 3 primary zones, referred to as the resting, sleeping zone, the ready to eat or play zone, and the rebooting, fussing or crying zone. However, early babies are still developing distinct zones. They spend a lot of time almost to one of these zones or another. As we see here, this early baby looks like she is settling down to sleep after a good feed, but in only a few minutes she is fretful again and needs some help. It's time to feed this baby, but after simply changing her clothes, she seems overwhelmed and falls off to sleep again. Though unpredictable behavior is normal for early babies, parents can take 2 steps to help their baby continue the development that began inside the womb. The first step is to put baby skin to skin, not t-shirt to t-shirt, as much as possible. The warmth and smell of mother's skin replicates baby's life in the womb. Skin-to-skin care stabilizes baby's heart rate, respiration, and temperature, helps her organize her sleeping and eating cycles, increases mother's milk supply, and boosts parents' feelings of attachment to their baby. The second step in learning to care for an early baby is noticing when your baby sends out an SOS, sign of overstimulation. All newborns are, at times, overstimulated as they adjust to being out in the world. Babies born early, SOS more often. Early babies can be extra sensitive to their environment and are easily overstimulated by noise, bright lights, or even routine baby care. Babies send out an SOS in 2 ways. The first is with changes in their body's skin color, movement, or breathing. This baby, who was born a few weeks early, shows all these body SOSs. See how his face turns a bit red in color? His muscles jerk and shake, and his breathing gets faster? These behaviors are typical for the early baby. The second way babies send out an SOS is with changes in their behavior, spacing out, switching off, and shutting down. Though these behaviors do signal overstimulation, they also can be seen as a baby's attempt to manage the amount of stimulation coming her way. This baby demonstrates the first behavioral SOS, spacing out. As mother talks to her baby, she notices that baby's eyes are especially wide open. She looks like she is glancing over mother's shoulder, as if to avoid looking at her mother's face. Baby seems to be staring into space. This spacing out is a subtle sign of overstimulation. This baby demonstrates the second behavioral SOS, switching off, known in the medical literature as gaze aversion. The harder the mother tries to get the baby's attention, the more the baby looks the other way. Mothers are relieved to learn that this behavior is not a sign that the baby is rejecting her. This baby demonstrates the third behavioral SOS, shutting down. Here we see efforts to play with a baby. Though the baby is momentarily engaged with that play, he soon becomes drowsy and shuts down as a response to too much stimulation. With early babies, it can be hard to tell whether a baby is going to sleep or shutting down. Notice the baby on the left. His face is relaxed. He has no tension around his eyes or mouth. His skin color is uniform. However, the baby on the right is demonstrating the shutting down SOS. He looks like he's squeezing his eyes shut. Notice the tension around his mouth and eyes, and that the color on his forehead is red and blotchy. A traffic light analogy may help you notice SOSs and respond to them. Watch for your baby to signal green for go ahead, yellow for caution, and red for let's stop for now. You'll know baby is sending out a green light when you see that her breathing is regular, her skin color is even, not red or blotchy, and her muscle tone seems normal. She may have a few tremors, but not be overwhelmed by them. Her behavior signals that now is a good time to feed the baby, snuggle with her, or look quietly at her face. All early babies will at times signal caution by sending out SOSs. Remember the baby with the body SOSs? His face turned red in color, his muscles jerked, and his breathing got faster. This baby looks drowsy or glassy-eyed as she spaces out. She sends out a yellow light by moving suddenly from peaceful to agitated. Parents soon learn that they can respond to a caution signal by decreasing stimulation and increasing support of their baby, actions that closely replicate life in the womb. The womb has a constant temperature, little light, and muffled sounds. Though baby might enjoy the sway of mother's movement, baby's arm and leg extension is limited by the uterine wall. Baby is learning to suck and swallow and can even grasp her umbilical cord. Decreasing stimulation and increasing support of the baby will bring the womb to baby's new room. Decrease stimulation by speaking quietly to the baby. Turning down lights and sound in the room can also be helpful. Because early babies may become overly excited by looking at your face, glancing away from the baby for a moment can help settle baby. You can increase support of the baby by bringing baby's hands to midline and then holding her hands to her chest. These actions, plus putting gentle pressure against the sole of baby's feet, may remind her of the comfortable restrictions of the womb. Triggering baby's grasp reflex by putting a little pressure on baby's palms and offering baby a pacifier can help the early baby practice self-comforting skills he was learning in utero. Swaddling, gently swaying baby, or putting baby to the breast for comfort may bring her back to the green light. At times, an early baby may escalate to a red stop signal. She might pause in her breathing. Her skin color may pale. You might see more jerky movements and tremors, and her muscles may feel limp. Baby will likely get more drowsy, less responsive, and even shut down as if asleep. When your baby sends out a red signal, stop all feeding and interacting for a moment. Take actions advised for the caution light. Consider putting baby skin to skin, and discuss these behaviors with baby's physician. Listen to a mother describe the behavior of her baby, who was born 4 weeks early. Baby is now 2 weeks old and still 2 weeks from her due date.
Of course, because I've had 4 kids, I kind of know what to expect. And in the hospital, she just had little tics where she would jerk or her eyes would roll in the back of her head and she would just fall asleep at the drop of a dime, and we would change her clothes or weigh her even. The startle reflex would just be really too much for her. She would turn beet red and scream, and just it seemed so traumatic. Next, you explained to me about premature babies being overstimulated and how they can shut down to keep from processing that information so it doesn't overstimulate them. They kind of shut down. So yeah, this is 6 months later. With Miss Tedder's help, we learned how to keep our babies comfortable and how to make sure that we don't overstimulate our babies. And because of that, we have a 6-month-old superstar. When I tell people she's a preemie, they just laugh and say, yeah, right. Yeah, that's right.
Noticing and responding to your early baby's SOSs will help prevent the stress of overstimulation and allow baby to continue the development she missed in the womb. With your help, she will begin to develop more predictable zones. More mature zone organization, as we see here, makes it easier to know when baby is ready to eat, helps baby sleep longer and better, and enhances her ability to interact with you. Day by day, you will become more and more the expert on your baby and better understand what he's telling you as you provide the care he needs to grow and thrive.